Hi, my name is Scott Thomas. I'm a comprehensive ophthalmologist in San Antonio, Texas. Today I'd like to talk to you about the X1 Iris expanding ring from Diamatrix. The indications for this product are the same as any other iris expansion device. When we have small pupils, poorly dilated with our typical pharmacological agents, we need a mechanical dilation. Iris hooks have been used, tried and true for many years. But there are also several options now for iris expanding rings that reduce the need for making extra corneal incisions like you do with the iris hooks. The Expand NT, also known as the X1 ring, is a device for iris expansion. It creates about a 6.7 millimeter aperture in the pupil. It's made of a nitinol alloy, which makes it very flexible and very durable. The ring consists of 4 pockets or feet which gently cradle the iris rim. It creates a stable environment where the pupil is out of the way and permits a atraumatic phacoemulsification. The insertion of the ring is very intuitive and straightforward. The injector here in picture 1 is going through a 2.4 millimeter corneal incision. The iris ring is deployed simply by advancing the plunger on the device. As the leading foot enters the anterior chamber, it's very easy to direct it towards the distal iris rim and engage that iris rim. Once it's engaged and you continue to advance, the lateral feet will deploy simultaneously. These are also engaged in the iris rim while the ring is still engaged in the injector. The trailing foot is left free-floating in the anterior chamber and needs to be placed manually with a hook instrument as seen in image 4. The removal of the ring is quite simple as well. The subincisional foot is simply removed from the iris with the same instrument. The remaining feet can be disengaged, and once the ring is free floating in the anterior chamber, it can simply be extracted through the main corneal incision. An alternative is to place the injector into the anterior chamber, grasp the ring, and withdraw it into the injector prior to removing it from the eye. That will be seen in the video coming up. So to demonstrate the use in a real-world case, we have a very difficult cataract surgery here where the X1 ring was extremely helpful in accessing a dense nucleus. As you can see, we have posterior synechia attached to the anterior lens surface. You may also be able to appreciate that there is some zonular instability as the iris and the lens are moving somewhat independently with these minimal manipulations. Viscoelastic is used to break most of the adhesions between the iris and the lens capsule. Once all the posterior synechia have been ruptured, the pupil is ready for the iris expansion device. Here you can see the injector going through the 2.4 millimeter corneal incision. The plunger is advanced and the ring is engaged first at the opposite side of the iris. As the ring deploys, one lateral foot followed by the other are engaged. I found it very easy to get all 3 of these feet placed at the initial deployment. The last foot has to be engaged with the second instrument. Most common hook instruments will suffice. And you can see that there's minimal iris stretching when that 4th foot is placed. The case proceeds without any further interference from the iris, which is retracted out of the way. You can see how manipulations of the instrumentation are easy because the iris ring is out of the way. The main incision is right over one of the feet, and the elevated portions of the ring are not disturbed by the forceps or phacoemulsification instruments. After removal of the lens material, the IOL can be placed as normal through the same 2.4 millimeter incision. Once it's secure in the capsular bag, the iris ring can be disengaged and removed. As promised, this video shows one technique to remove the iris ring with the injector. The subincisional foot is disengaged from the iris and elevated into the mid-anterior chamber, where it can be grasped by the injector. Once all 4 feet have been freed up from the iris, the device is positioned for removal. That foot is positioned immediately in front of the main corneal incision, where it is easily grasped by the injector. For proper folding, it's important not to grasp the ring too far down the injector or at the tip, but in the center of the injector device. Once it's in the proper position, the plunger is retracted, the ring collapses into the injector. The second instrument here is used to ensure that the ring stays in a planar configuration and does not move anteriorly or posteriorly as it retracts, avoiding any iris or cornea trauma. So as that case demonstrates, the ring provides an excellent retraction of the iris. It leaves the iris undisturbed. There's no excessive traction on the iris root. The pupil margin is maintained and can resume its normal round physiologic configuration. The device is very easy to use, it's intuitive, and it has a very short learning curve. Thank you very much for watching the video.